Communication is one of the most essential skills in healthcare and the foundation of a trusting relationship between patient and medical professional. If patients can express their ideas, concerns, and expectations in the beginning of the consultation, they are more likely to follow the doctor's recommendations and to be satisfied with the visit. At the same time, the doctor's time to gather all essential information is limited, which makes a structured approach necessary. Studies have shown that patients need about 2 minutes to speak about the crucial issues. Nevertheless, many doctors interrupt their patients after an average of only 23 seconds. We use a simple description of the consultation as consisting of 3 parts, according to who should be leading the dialogue at the time. The consultation begins with the patient's part, during which the patient has the freedom to express their pre-consultation experience, like symptoms and problems, and their thoughts, like ideas, concerns, and expectations. Next comes the doctor's part, when the doctor selectively gathers information relevant to the task of translating the patient's narrative from lay language into medical constructs. Finally, in the shared part, doctor and patient cooperate to arrive at plans and decisions acceptable to both of them. How can I help you today?
I'm actually here today because I have a headache since a couple of weeks already.
Oh, a couple of weeks already. Okay. How many weeks?
Actually, that's about 5 weeks it started.
Oh, wow. Okay. How did it start?
In the beginning it was only a slight headache, but then it became more and more, and now I have actually like every day.
Okay. Have you ever had episodes of severe headache before?
No, not really.
Okay. How would you describe the pain?
It's a numbing pain. It's more on the right side here. And
does it radiate anywhere in your body?
No, I wouldn't think so.
Although it is widely accepted that the doctor should allow the patient to speak freely at the start of the consultation, many doctors find it difficult not to interrupt and tend to medicalize the patient's presentation prematurely. The 5 cards approach can help the doctor avoid closing down the patient's part prematurely. Imagine that the patient holds 3 kinds of thoughts cards: ideas, concerns, and expectations, all of which need to be played during the telling of the story. Your task is to help the patient play all 3 thoughts cards. To achieve this, you have 2 kinds of response cards of your own in your hand: receipt and summary cards. When the doctor gives response through a receipt card, he catches the patient's attention through expression of empathy and indicates that he has understood the patient's problem. When the doctor sums up the patient's information, he can reassure if everything has been understood correctly, and the patient gets the opportunity to revise misunderstandings and to add relevant information. Hello.
Hello.
How can I help you today?
I'm having headaches since a couple of weeks already.
Okay. That sounds really troubling. Can you tell me a bit about it?
It started like 5 weeks ago, and it's mostly daytime.
Okay.
And in the beginning it was a slight headache, and then it became more and more. And now it's on a daily basis.
I think it's very, very good that you came here today. Do you already have any ideas what might have caused the headache? Anything in particular?
Yeah, I actually, I don't know if it's some kind of stress related. I noticed that stress can trigger headache. Yeah, I'm not quite sure.
But have you been under a lot of stress recently?
Sort of job stress, and yeah, this I don't know if this could be the reason.
Is there anything you're worried about? What could be the cause?
Yeah, actually, one of my colleagues has recently diagnosed a brain tumor.
Okay.
And it started also with headaches. He had headaches like 6 months. in a row, and then he finally got a brain scan, and it showed that he had a brain tumor. So I'm actually worried about that I could have the same.
Okay, yeah, I understand your concern, of course. So, how do you think I can help you best?
I would like that we make some examinations to see that's not a brain tumor.
Yes.
And then I think maybe what I can do to reduce the headache problem.
Okay. Is there anything else you would like to talk about today?
No, that's it actually.
Okay. So let me just sum up what you've told me so you see I got everything right. So you've had a headache for 5 weeks and it's been constantly there. You've been under a lot of stress recently, and you've told me about this colleague of yours who has a brain tumor which has been diagnosed recently, who also had a headache before. Okay, so I would like to ask you some more questions to find out what's behind your headache. Is there anything else you would like to tell me?
Not at the moment.
Okay. By using receipt and summary cards, the doctor can show the patient that his problem has been understood and will be taken seriously. Knowing the patient's ideas, concerns, and expectations makes it easier to discuss and decide an adequate diagnostic procedure with the patient. Concurrently, the patient's satisfaction increases and the risk of legal disputes declines.